We have a really full, beautiful conversation waiting to happen. So we're actually going to start promptly at 3 p.m. Thank you so much for joining us. I'm Daniella Topol, the Artistic Director of Rattlestick, and we are proud to do this in partnership with Reimagine and Village Preservation. And Reimagine, actually, with all of their events this month, they are having opening remarks. So I'm just going to read a short paragraph from them, which is really in the right spirit of this Salon, which is why we're partnering with them. So here we go. There is no life without death, no love without loss. They are in constant complementary motion, but never before in our lives has the world stood so still. In the face of distance, illness, and isolation, we are here together, reimagining a changed world, kinder, slower, more just. We are reimagining the giving and receiving of love, the cycles of loss and new beginnings, and what it means to be fully alive. We are here. So on that note, thank you so much for being here with us. The panelists' bios are going to show up in your chat so that we don't spend time reading their bios out loud to you. I would love for each of our panelists to speak about a small moment that happened to you today that relates to this subject, your life as a healthcare worker, and some small moment that happened with you today. So I'd love to start with my sister, actually, my older sister, Deborah Topol Rosenberg. Can we kick off with you?
Sure, and it's very nice to be here working professionally with my younger sister. I'm an internist at a very large hospital in Washington, D.C., and we have been switching to doing a lot of telehealth, and it is good that we're able to do that, but on the other hand, so much is lost, and the switch to telehealth symbolizes for me how much this has changed all our lives. Seeing people through a video screen, losing the ability to walk into a room, look in my patient's eyes, shake their hand, somebody I've known for a long, long time, give them a hug and just be like, it's great to see you. And on telehealth, I can't do that. And then you wonder, well, when can I do that? Will I ever do that again? Does this change the doctor-patient bond forever? And that sort of encapsulates just a glimpse of what I see COVID has done to really impact the medical landscape, in my opinion.
Great, thank you so much, Deborah. Stacey Rose, a playwright and a respiratory therapist, actually under commission with Rattlestick right now on a new play, which is very exciting. Do you have a moment that you want to share?
Yeah, it's a little, I feel like I'm constantly balancing work and my career as a writer. I spent probably the last almost 48 hours in this fog writing this pitch document, and then in the middle of it I go, wait a minute, I've got to pack because I'm going to work, and I work in Durham, and I'm just kind of gearing it. It's just a mental shift to prepare, because I do see patients at bedside. And what's weird and kind of I don't know, eerie, is that for where I am in the Southeast, it's sort of, as like elective surgeries are ramping back up, we're seeing more patients, but the hospital, outside of like the units that are very intense and have COVID patients, like we have a COVID step down unit, and we've got a unit that the ICU that of course has your COVID vents and regular vents and all of that. Outside of that, it's been pretty quiet. Like, it's an eerily quiet hospital outside of that. And from what I understand, that's been picking back up. So kind of doing that mental shift between just kind of the fog I get in when I'm being creative, and then having to focus the mind on patient care and paperwork, which sounds trivial, but it's a huge part of my job. And then just kind of dealing with the personalities that you see when you work. And I love my patients. They truly when it really gets hard. So I see what you mean, Deborah. Like when I can't, like, I don't know how I would do my job without like physically being in the room, because it's just, you know, they're part of like the engine that keeps me going when everything else, when the hospital politics, when everything else feels crazy, when the world feels crazy, just coming in and having someone look at you and go, are you the person who's supposed to have my orange juice? Like, and it immediately kind of snatches you back down into this, and just to being human and being regular. So just, yeah, the shifting of my mind from that place of be creative to, yeah, you have to go take care of these people.
I see a lot of nods from our other panelists. Carlos, do you want to jump in here?
Sure. This morning I was chatting with a colleague about the weekend and, you know, going on hikes this weekend and being out in nature. And she said, I'm so happy that you have been able to keep a normal, you know, sense of life. And I said, no, actually, no, my entire life have been uprooted. You know, I left the city. I'm living with my mother-in-law. My spouse and I have agreed to give up our apartment in the city. Nothing is the way it used to be. I have not been in a play, in a concert. I have not gone to a gallery. I haven't been in a restaurant. Life as I knew doesn't exist anymore. And I show up to work, and I guess people feel like, you know, sort of keeping a life as it was, and it isn't. And it reminds me that this is what's happening to me, and what kind of shape that takes for everybody else in terms of what this done to us, from our inability to have close contact to our patients, to those we work with, even to those we love. Today, you know, this weekend, you know, we have a socially distanced barbecue. I used to hug my friends. Instead, it's like the hamburger is over there, go take it. And it's just how we are negotiating. But at the same time, it was very humbling for me this morning when I realized, no, there's nothing normal about what is happening to me right now.
Yeah, and Shannon, I saw when Stacey was talking about the orange juice, I saw you really laugh about that. Does that speak to sort of your experience?
Yeah, I kind of I feel like there's all of the science and the you know, the studying and the academia behind being a healthcare worker. But then, like, to really like convey just taking care of a person, it's just like getting them simple things like, you know, just getting you an orange, making sure you have your orange juice, you know, it makes them feel like they are being taken care of. It's about the caring aspect. So I laugh because like that little gesture can really just make a connection and make the patient feel heard, that which I think is such an important thing as a healthcare worker, is to make your patient feel like you are listening to them.
Dana, do you want to share a moment from your day that's resonant for you?
Yeah, you know, and as I'm listening, a lot of what we're talking about, we're using the metaphor of orange juice, but it is having a basic need met. You know, that's what we're talking about. Before we can actually exist in relationship with others, we need to make sure all basic needs are met, and orange juice, water, those types of things. I think a moment that's sticking out for me is we're about to move into another phase of unknown, which is the reopening of spaces. And I had a conversation with a staff member today who had been redeployed to work in staff wellness and is coming back to work in our inpatient behavioral health service. And we were already anticipating the experience of loss, kind of all of the supports that have been sent out by the mayor's office in terms of lunch, or the notion of who's going to take care of the staff that I had been taking care of now that I'm returning to take care of patients. And so that's kind of something that's filled me a lot today, is there will be a moment, and I'm hoping it's a gradual one, but there will be a moment where those supports stop. And I'm just thinking about anticipating what that experience will be like.
So there's so much that we're covering, and I actually feel like with other panels that we've done, we've had an artistic segment at the beginning and an artistic segment at the end, but we've never had panelists that are so artistic in and of themselves. So actually we have 4 of the 5 panelists have their own writing that they have done, and because Stacey Rose is a playwright, Shannon Burkett is a writer and an actor, Dana and Carlos also work in theater, and my sister just wrote a poem. So we're going to hear these throughout the salon. So right now we're going to hear back-to-back Stacey Rose's letter, lyrics to a song that Shannon has written, and a narrative that Dana has written. And each of our panelists will set up their own writing, and we're going to hear the writing one after the other, and then we will discuss the writing. So why don't we go ahead and we'll start with you, Stacey Rose.
Absolutely. So the piece I'm going to share is called "A Letter to the Respiratory Therapist." I wrote it on March 20th of 2011. And I don't remember the night before, but I distinctively remember it was a hard one. And I got off work and I wrote this. Dearest RT, I have often said that we are the redheaded stepchildren of the healthcare industry. Not yet able to enjoy the respect that comes with longevity of similar careers like nursing. We are still, after decades of existence, a bit of an enigma to everyday people. Some might have noticed our name yelled during Respiratory's episodes of their favorite hospital drama. After all the business of saving lives is complete, the heroic MD yells with deep conviction, "Call Respiratory and tell them to bring a vent," as he clutches an endotracheal tube that is nowhere near secure in the patient, that isn't even being bagged. As if we're off somewhere slamming down donuts as we wait for vents to be called for. What everyday man often doesn't know is we would have been there from the word go. Nor do they know that in many cases, it is us who often secures the airway, initiates life support, and then asks that the MD get called so we can tell them what we did. Little does everyday man know how hard we work to cover anywhere between 10 to 25 patients per therapist per shift, while having to be prepared to drop it all and see about the emergencies and quasi-emergencies whenever summoned. We are often unappreciated, misunderstood, and unfortunately mistreated by those whose team we're supposed to be on. Yes, redheaded stepchildren. Notice I said often, not always. As there are those times, hospitals, and situations where all the stars align and therapists are truly made to feel a part of the team. Our experience and knowledge are valued. People actually know our names instead of yelling respiratory down the hallway behind us. I have been fortunate now in my almost 12-year career to have enjoyed these circumstances, and I'm truly grateful for these times. When it's bad though, it's really bad. I've worked in places where therapists have been reduced to the role of nothing more than a button pusher or a knob turner, having their clinical skills and knowledge completely disregarded by people who often don't fully understand the purpose and action of the therapies they're requesting. Then being told or shown by their own management that we have to take one for the team. To understand this, I have to go back to the point that the general public, and alas, some healthcare professionals, have no clue, or worse, no respect for what we do. I don't pretend to know how to change this other than to keep doing what we're doing. Do it well, do it consistently, stay educated in our field, and stand our ground in the face of adversity and ignorance. Combat ignorance with education and open dialogue, and maybe, just maybe, things will change. I write this letter from a place of appreciation and love for everything this career has done for my life and the many wonderful people it has placed in it. My patients, the reason why I can do what I do in the first place, the good ones, the mean ones, the in-between ones, but especially the pleasantly confused ones whose shenanigans make my night whiz by. The nursing staff who I've saved lives side by side with, cried with in tragedy, and even laughed with in tragedy. Because you got to keep laughing to keep from crying, right? The MDs who don't let their egos get in the way of what is best for the patient, who, once they understood that I knew what I was doing, allowed me to do my job. The unit secretaries, radiology, lab techs, pharmacy, environmental, hospital security. Without you guys, there is no us, because we are all critical to the lives of our patients. We care for, to the lives of the patients we care for, whether we know or are told that or not. In the process of stepping back from this career, I'm in the process of stepping back from this career that has been a defining part of my life since I was pregnant with my son and into one as a writer. Eventually, if all goes well, I won't be practicing much, if at all. However, everything I learned while a therapist will carry me into the tough business of the written world. After all, what can thicken your skin or grow you as a person more than dealing with life, death, and every manifestation of the human being on a daily, nightly basis? I promise to one day write our story, that people may continue to come to better know and understand who we are. I promise to tell our story to the best of my rotten ability. To all my fellow RTs, your name is not Respiratory. Your knowledge and experience matter even when those around you would make you feel that it doesn't. Go forth, give nibs, save lives, be as brilliant as you are, and smile because you are somebody. With love, Stacey Rose, RRT, RCP.
Much love to you, Stacey Rose. Ms. Shannon, can you share your writing?
That as a nurse that worked in the neuroscience unit, I worked very closely with the respiratory therapists, and they really are truly like the backbone. And when you have patients who have compromised airways, absolutely essential and an essential part of the team, and absolutely deserve every ounce of respect. And I stood side by side, given NEDS too, so lots of props to her. I'm glad for my team who can help me out here. My song is called Only Two, and I don't know if you heard, I work at Mount Sinai, and I was overlooking the atrium where they had the makeshift ICU units for COVID. And I was listening to an intubated patient, and this was right before they were, sort of ending and sort of like ending that era of having the makeshift COVID units in the atrium of the hospital. And I wrote this song. The curtain parts, exhale on cue, crash cart, fingertips blue. This one likes peanut butter on crackers, that one danced the nutcracker. This one bathed the moon blue, that one can make elephant balloons for smiles. In the end, there are no disguises, paper thin in this sea of white, cacophony of mechanical life, divided but one, only two will survive. This one carried the sorrows of the world, that one laughed on the tilt-a-whirl. This one praised with an empty heart, that one made millions with her upstart. In the end, there are only surprises, paper thin in this sea of white, cacophony of mechanical strife. Divided but one, which two will survive. Divided by white, multiplied by numbers, who lives, who dies, unencumbered. His last one, her last breath. Who will be the last to survive? Who will be the last to die? In the end, there are only surprises, paper thin in this sea of white, cacophony of mechanical strife. Down to two, but only one will survive. Who lives and who dies, this last one, that last breath, that last one to die, this last one to survive.
Okay, so Dana.
Sure. Stacey, I can relate to the notion of people not knowing what you do. I am a drama therapist working in a behavioral health center. And people often ask me, is that theater for actors? And yes, of course, actors need therapy just like the rest. But no, it's actually using theater to help achieve therapeutic goals. And so the piece that I'm going to share with you, as a drama therapist, I process my work by creating what I call embodied case narratives. And this is a piece that I wrote, it's a musing on what it means to wear a mask. So it's called My Many Masks. I miss my mask, my face, the mask beneath the mask, the one I used so much to convey empathy and compassion, the one I used to say good morning or a facial expression to suggest I am here with you. Where is my mask gone? Who has taken it? And when can I have it back? As a drama therapist working in inpatient psychiatry, I rely so heavily on my facial expressions to guide my work and show attunement to the individuals in my care. Not to mention how much value I place on being able to witness my clients' facial expressions to understand their shifts in affect and processing of our relationship. Now, here we are, sitting across from each other, masking ourselves to protect ourselves, to protect me from you, to protect you from me, to protect each other. Each morning I wake up and I have to remind myself that there's still a pandemic happening outside my window. Sleep does that, doesn't it? For hopefully a solid 8, 7, 6, 5 hours of the day. I do not have to relate to a world that is sick. The sun surprised me this morning in her mighty glow as she woke me. I imagined with myself with a gleeful naivete, perhaps the curse has been lifted and all is well. I threw open the curtains and shattered my Pollyanna assumption yet again, to discover that my once busy street in Midtown Manhattan is still deserted aside from the occasional essential worker passing by masked on their way to the hospital I live next to. I quickly return to myself and run through my checklist to reorient and reorganize myself to the day. Pandemic, check. Essential healthcare worker, check. Multiple masks, check. And then my day can officially begin. Over the course of the week since I've donned my mask, it's been an adjustment. You see, it's not common practice to wear a surgical mask in psychiatric care. My clients have responded to my mask in a variety of ways. Some go about the day as if not noticing. Some clients labeled as paranoid express their fear of what I might be concealing behind the mask, or perhaps I'm lying about who I am since my face with mask does not match the face on my ID without mask. Some have integrated into our play, and some refuse to see it as more than just a weapon against COVID-19. One client, let's call her Sarah, a queer, trans, female-identifying client pulled me in close. Well, physically, we were still 6 feet apart, but her essence and curiosity, the specific question she asked me, pulled me in. Can I ask you a personal question? Whenever a client begins to ask in this way, it's best to fasten your metaphorical seatbelt because you have no idea where their curiosity will take you. What I had today, however, was not my seatbelt, I had my mask as seatbelt. Of course, as long as I can be the one to determine if I answer it, I respond. Oh, definitely, she says, and continues with F to M or M to F. Even behind my mask, my queerness was afoot. Blessings. Community can find community despite the mask upon my face. She was curious about who I was behind the mask and wondered if, in fact, we traveled in a shared community. Neither, actually, I playfully advise. Gender nonconforming. It became even more apparent that she was seeking community and connection, perhaps seeking a mirror to reflect even a small portion of her multitudes. What was clear to me is that Sarah was reflecting to me a portion of myself, and I, too, desperately wanted connection and community. Mostly, I respond, still with mask on. Yes, live that life, Sarah shares joyfully while she waves and snaps her fingers in the air. Thank you for seeing me behind this mask, I share. Aren't we all too familiar with mask wearing, she shares, with what I imagine to be a smirk beneath her mask. We both laugh heartily as our conversation moves beyond our masked musings. We ended up having a deep conversation around transitioning and voice and being clocked, and her thoughts on getting infected with the fear of not being able to bind and the disruptions in hormone replacement therapy during Corona times. We traveled a great amount of territory in a moment that disguised itself as a simple greeting. Can I ask you a personal question? Right now, every question, regardless of the content, feels like a personal question. Each "how are you" no longer receives a fine, but instead a sigh and a string of words that work to form cohesive sentiments. We no longer speak in short stories, instead we carry novels. Every question feels personal because every question is personal. My mask, the one I complained about earlier, in this moment actually served as a guide. Would this conversation have taken place if my visage had been exposed? Honestly, I don't fully know, but there's a part of me, that part deep down inside, that tells me no. If I was not wearing my mask today, if the aesthetics of our performance had been different, I don't believe I would have been stopped. It was something the client heard, and despite my best attempt at wearing my butchest work drag and my PPE, it was my mask they clocked, how the mask was worn, the mask behind the mask, the human behind the mask, the persona behind the mask. And for that, well, for that I'm grateful. But do I want to wear a mask forever? Absolutely not.
So now we'd love for the panelists to respond to each other and the writing that you heard. And maybe we'll start with Carlos and Deborah just as listeners, but just then toss the ball out to everyone to sort of speak about what you heard and what resonated for you.
Sure, I'll start. This work is amazing, what I heard, and so much, I'm like, yeah, that's me as well. There's so much that's so universal about all of this. Stacey, we need respiratory therapists. They save us, and we need the team. We know we need the team. And if we're gonna survive this and the future of COVID and what is gonna happen, we are going to need a team. We're gonna need to work as a team, and we're gonna just need to be able to take what every person has to offer and work together for community healing. So that struck me a lot. The whole mask thing is so difficult. It is so difficult for doctors and masks. And then Shannon, your song was just so beautiful. You think, and I thought that when I was screening people for COVID, I'm like, is this the person who's going to be okay? Is this the person who's not going to be okay? And that uncertainty is very difficult. And I think a large part of what makes this very difficult is all the uncertainty of who does fine, who doesn't do fine. The randomness and the uncertainty is difficult. And everybody's pieces just really impressed upon me how universal all of this is, no matter where we are.
Also, what I hear is how in the middle of this pandemic, the roles that are called upon that it may not be what we usually tend to perform in our daily professional lives or even personal lives. And how at times those are roles that we're gonna play willingly, but some of them are called upon and we may be not quite comfortable with them. And then there is, how the rest of our community gets to see us, how they call us, who we are, and what we hold dear within these in these times. And what does that say about us? But also, what does that reveal of what people are summoning upon us to do? The roles we're expected to take on, and the role we're expected to let go in the middle of this pandemic in order to function and in order to support a very complex set of needs that have been changing very rapidly. I'm just humbled by the aesthetics of these productions and these pieces, and really want to thank you for sharing that with us.
Shannon or Dana or Stacey, Rose?
I just like in general, the nuance, Shannon, Like, that's the thing. I feel like I'm always, I think in the beginning, because my mom got sick and I kept waiting for the other shoe to drop. I kept waiting for what were very atypical COVID symptoms. She had like GI stuff, and that was kind of it, to transition to that shortness of breath. And eventually, because she had the stuff, right? She was 71. She, you know, she had high blood pressure. Like, she had like the comorbidities and everything. And she came through this thing like a rock star. And there's this sense of feeling that I dodged, or we as a family dodged a bullet, but how also like this sense of guilt around how fucked up it is that people lost people who just should not have died. And there's so many complicated feelings I'm having, in that song just kind of, it holds on to so much of it. And so simply and so beautifully. So thank you for that. And Mask, my God. Like, honestly, I feel like every time I'm talking or dealing with someone else, it can be I'm dealing with a supervisor, then I'm dealing with a patient, then I'm dealing with a nurse manager, then I'm dealing with my family member who's calling me about something that they're trying to figure out, and then I'm getting a text from someone who's telling me their cousin has COVID symptoms. I'm like, what is happening? And it's like, when do we get to be us? And when do we get to be who we are? Because after all, like, I like to think of myself as a helper. It's an honor to be considered a hero, but helper feels more comfortable for me. And so feeling like I can be vulnerable and I can still be human, despite the fact that I've done this thing that I've done now for 21 years. And, you know, it's kind of upfront because of the time we're in, but just getting a chance to just slough off everything and be human is something I look forward to.
So I'm going to throw out a question that I know is probably on everyone's minds, and Dana mentioned it, which is the conversation about things starting to open up and what your concerns are, what you all feel, you know, about this moment forward. It would be great to get everyone's take on that.
Well, I mean, I think then we're back to this whole uncertainty again. So that, I think, is the huge fear. So what's going to happen now? Like, we finally are at a place where, like, okay, we can bring back the medical students. Okay, we can start the elective procedures again. Everybody is sort of feeling, okay, we can start getting back to a different normal. We're okay. It's going to be a different normal. I'll make peace with that and make it work. But the idea of, oh, we have to go way, way, way back is very worrisome to me.
And I think, just to quote Shannon's song, in the end, there are only surprises. And so, you know, in thinking about what's to come next, it's, you know, it's that anticipation. And I don't believe we'll ever go back to where we were. We have to understand where we've come from to know where we're going. And when I think about the next steps, I'm hoping that everything that I've gone through, that everything my colleagues have gone through, that everything my patients have gone through, that it actually has built within us a muscle memory, a resiliency, a new relationship, that complementary motion that you were talking about earlier, that things aren't going to feel as foreign, but instead holding on to both the history and the future and being able to exist in that space. It is simultaneously terrifying and exciting, because I'm hoping that all that we've learned over this time is going to prepare us to move through this next phase. And as long as everybody continues to engage in that shared humanity, my hope is that it will be a little bit better.
Oh, sorry, that's unmuted. Sorry, go ahead, Shannon.
And of course, like, the mask is universal and such like a ubiquitous like symbol of so many things these days, and you encapsulated and captured that so beautifully. The thing that I will say is, I was so excited the other day when the doctor said to me, when we first started testing everybody that came into the hospital, we were at 40% positive. We're now at 13%. So for anybody that is curious as far as like, has this actually been flattening the curve? And yes, it has. Yes, it has. We have been able to close down like our makeshift COVID units. I just would hope that that we all just sort of do what we need to do to stay safe as everything reopens, and it all has a lot to do with a mask, and do our part to wash our hands or wear gloves and a mask. We have this very human need to be in a community and it's our mental health as well as like our physical health, and I understand that and appreciate that. And the other thing too, with people feeling some sort of like comfort or solace in this time that we have taken and the sacrifices people have made in order to save lives, is that we've learned so much. Very simple things like putting patients on their stomachs has dramatically increased, like their chances of their survival and therapies, and we just know more. The longer we flatten that curve, the more time you gave people, the healthcare industry to learn how to combat it. So I also just want to say thank you to everybody who like participated in this by staying inside, and as we go out forward, just wear a mask and wash your hands.
So this is not. Question is feels pretty fundamental about the vulnerable populations that are being most dramatically impacted by COVID. Can you talk about that in each of your different works, and how you address those inequities, and anything we as a community can do too would be really helpful to hear as well. I can call on you.
I'll go first. I actually transferred in the middle of this, beginning of this pandemic, from the neuroscience unit to mother baby. So some of my population changed from the elderly, which I would say were my primary patients that were the most vulnerable, age, hypertension, diabetes, comorbidities. I work with teeny tiny brand new babies and pregnant mommies, mothers who have just given birth. I would say that support institutions and places that allow for, shopping hours for people who are vulnerable, so they don't have to shop with other people. Offer to get your elderly neighbor groceries and see them outside the window so that they still have some communication. I would just say support that community the best you can with and helping them keep safe, which is helping them keep distance, and supporting them by feeding them and getting them groceries and doing whatever it is they need in order to keep themselves safe.
And I think too, really just thinking about the profound loneliness, and I worry about that in the vulnerable people who live alone. And I think any degree, if you've got elderly parents or grandparents and you're calling them once a week, just call them 2 or 3 times a week. You just, more connection, more reaching out. I think the underserved population, that's who we're seeing, like that's who is coming disproportionately to our urban hospitals. So they're needing a lot of support. And it's hard too, because they're coming to our hospitals, but now they can't have visitors. And it's understandable, the rules for, why they can't have visitors, but then sort of understanding this is extra hard to be a patient in a hospital, which is hard to begin with, but now it's even more difficult. And then you've got healthcare workers who are wearing a million things and coming into their room with masks and eyes and gowns and can barely even see them. So I think acknowledging that to your patients when you're in the room with them is another really important thing that we can and ought to be doing.
I think couple things. One, like, I don't know, like right now I'm in the Southeast. So it looks a little bit different for us in that our patients are allowed at least one visitor. I think specifically about things like mother baby, things like that, like their partners are allowed to come in to deliveries and things like that. It's a little different here in the Southeast for a variety of reasons, mainly because an issue that is not an issue of politics has definitely been made one. And so you're kind of in this push-pull with people who want to get the economy back on track, but on the other end, people are dying. And so I think about Black folks, and here specifically, but also everywhere, who are, and brown folks, and just people of color, or people of like poor people, and that's probably not the right word these days, but here we go. There are folks who, by socioeconomic circumstance, who cannot isolate, who are not necessarily getting the best information. So I think if you're the person in your family who seeks out good information, give that good information to your family members, your granny, who wants to go to church on Sunday, but and her pastor says she can come back, tell her why she shouldn't. Like those are the type of investments I would love to see more of. It's just like, it's really hard. I have a 21-year-old son, and he and I have gone back and forth because I believe he's been an asymptomatic carrier of COVID. And I'm like, this is how you affect other people. And I think eventually it landed. But it's just having those conversations with young folks too, and letting them know that they are really driving this bus in a lot of ways. Also, I think about what I don't hear a lot about is people who are suffering with addiction issues, think they might have addiction issues and all of that, but don't necessarily are in a place. I mean, we've been quarantined, and people who were like an occasional weekend drinker, it's kind of transitioned into something else. Help is available. There's tons of recovery meetings on Zoom, phone lines, things like that. You can go to NA or AA.org and look those things up. Those things are important too. Our apps like BetterHelp are offering discounts for people who are unemployed. Mental health is a huge issue, and just just staying aware and trying to get the best information and sharing information that is as true as that you can have verified in a couple places. I have the privilege, like I read medical journals, so I'm just like, I don't want to hear shit, but what JAMA got to say about it. Like, I don't want to hear I don't want to hear nothing. What did JAMA say? But not everybody has that. I say, look in 3 news sources, and if it, quacks like a duck and walk like a duck, it's a duck. So just kind of really know where you're getting your information from and share it with your young folks, and protect your older folks. Record that church service for them or whatever. Get them what they need to sustain, but help them sustain.
I wanted just to follow Stacey on that, because I think the real big unmasking in the middle of all this masking is that we need to address issues of social justice. People of color, brown people, are much more at risk simply because of how we as society has set them up to be in situations where they cannot social distance or they need to go to work. We have people that literally, if they don't work, they don't eat. People that don't have unstable housing or don't have housing. And people that traditional are very suspicious of medical treatment because of our incredible history of injustice with people of color. So as a society, we need really to address this if we're gonna be really serious about changing anything. I'm not protected if the people next to me, if my community is also not well, which is the other piece. We're only gonna be well if everybody around me is well. And that cannot be, that I'm gonna run into my fabulous building, hide my apartment. That's not enough protection anymore. And that is, so if we're looking to be activated and we're looking to address real change, we need to address issues of social justice so people can access health and can remain healthy.
And I think what we're speaking to is the idea of how has it come to pass that these populations are considered vulnerable populations. And in that, we're talking about the historical context of the systemic and structural racism that just kind of exists in the healthcare system. Our healthcare system is built with a strong foundation of white supremacy. And when it comes to this idea of people seeking out care, if they have had any negative experience with healthcare providers in the past, the chance of them coming to the hospital, especially during a pandemic, is even less. And so I think the piece I'll add to what Carlos was sharing is really doing your own self-education around some of this as well, and your own advocacy, and being able to identify the places in your community that are designed to support people and seeking out the help that they need. I mean, concretely, we know that when people of color are assessed for pain, their pain is less believed than white people. And so when you're thinking about this notion of somebody coming in to say, I think I have symptoms of COVID-19, we need to understand just how these mechanisms are playing out and how implicit bias might also be performing in these relationships. And when we think about this notion of opening back up, also being mindful of the fact to not misdiagnose people with having psychiatric illnesses, but instead actually a human response to a pandemic. And that for all of us, that looks different. So yeah, I just wanted to add that piece to that. So thank you all for bringing that up, and Stacey for starting that conversation with us.
Thank you, Dana. That is so 1000% true. And that's a whole other conversation, but it is what I've witnessed with my own two eyes in terms of what certain patients coming through the door can expect in terms of care. So it's something we definitely have to change.
And here we are.
Can I say something?
Of creative people that we can activate our skill set to tell the stories and start shifting, masking these issues within our society. So right here, people can start writing some poems, plays, and start really exploring this at length.
It's so helpful to hear everything you have to say on the micro and the macro level on ways that we can be activated to help those in our own community, and also be aware of the larger injustices of the system. I'd love to sort of right turn here for a second and go deeply personal, if you don't mind. I mean, maybe not deeply, but go a little bit personal and say, how are you all navigating your work and your personal life? Like, how do you handle and carry the complexity of everything you're dealing with in your work life, and then return home and care for those in your family or have them take care of you? In what way are you distancing from your own family members as healthcare workers? What is the impact of all of that?
Yeah,
Can I say?
Oh, I'm sorry, go ahead. I don't know who that is, but anyway, I was going to say, well, that's something that's newer with this that we haven't had. Before, it used to be, how can I leave the emotional side of what I do at work so that when I'm home, I can fully engage with my kids and my husband and my family? So there used to be that piece. This adds the element of how can I separate what's physically on my person when I walk through the door, and this whole thing, some people sleeping in different rooms, sleeping in their garage, these elaborate regimens of I change in the garage, I walk in the house. Like, this adds a whole new element of, am I infecting my family? And oh my gosh, how am I going to feel if I infect my family? And that has never been there before. So I feel like we need to do what's logical, but then there's different answers as to what's logical. So I guess you have to do what's going to work for you and your family and your circumstance. But that is a new challenge with this one, because it's tough enough dealing with the emotional piece, but now we're dealing with the physical piece of coming in and being so worried that we're going to hurt the people we care about. So that's a big challenge here.
For me, I just for many years, I've always had a morning or a waking regimen, depending on like what shift I'm working, where I get up, I journal, and either it's meditation or yoga, or meditation and yoga, depending on what kind of day it's going to be. So I always do something that is grounding before I do anything. It's just my way to kind of settle myself into who I am before I move forward and have to be like 50 million different things. So that has become even more important in the middle of all of this, and is making sure I do it. But also, I keep my distance I know she's had COVID, but I try not to be around my mom as much, but those times when I get to, it's just the best. Like, it's the thing that it's so sustaining. Just to, like, she cooked out in her kitchen yesterday and sent me a bunch of food, and it was just the best feeling. So actually, just family, even at a distance, even for brief moments, even, has been fantastic. That and a fuck ton of music.
I think for me, I mean, I'll just be completely honest, it's hard. Like, it's not it's not easy to do this. What's happening is that we're all experiencing this trauma together, and it's not something yet that is a distant memory. It's not a retelling of something. It's an action that's happening right now. And I think some days are better than others. And I'm an avid roller coaster rider. And so physically and metaphorically. And I think being able to, I still work in psychiatry, so having touchdowns with actual humans, going to work in itself feels like a self-care, because I can actually see people in that way. I've actually not seen anybody in my personal life since March 12th. And so it's been quite a long time. My mother is ill, so I can't visit with them. And my husband also works in healthcare. And so we just anticipate the day where we have to actually separate. And so I've been doing my part to keep my distance. And part of the way in which I kind of care for myself, the writing that you heard today is something that really brings me joy, being able to process my own experience through my art, forums set up like this. And then also I'll say my students. I just finished teaching a class, and to see these individuals who are about to go into the field, the mental health field, and are just kind of chomping at the bit to lend support, to witness that, I think it's trickling a little bit into me. And I'm very much appreciating getting to feel that vicarious energy from them.
I would also just, sorry, go ahead, Carlos.
Shannon?
I just would also like to thank all the friends and strangers who donated to hospitals. I mean, it was so difficult to go out and get food, and all of these wonderful people donated to restaurants so that they could make food for us, and friends who lended support. It was really difficult to ride the subway. It was quite dangerous there for a while, and I mean, I had friends who just paid for cars for me to go to and from the hospital. So I think there were so many people who contributed in so many different ways. And I just wanted to say, like, no matter how small you may have thought your contribution was, it was appreciated. If you gave a little money for, healthcare workers to be able to get lunch, or, you did the small things, they all added up, and they felt, even if you just clapped at night, it meant something. And it just meant that, it just gave us that moment. We were like, well, we're not alone in this fight. There are other people out there, and they're rooting us on, and they're with us. So thank you.
I'm just grateful that someone decided that I was an essential worker, and I get to show up to work. And I think work in itself have kept me sane. I wouldn't do well at home. I'm not sure what I'm doing other than being very busy. Luckily, we have had to build things. We have created rooms, move furniture, and those things are good for me. So showing up to work has helped. Um, I'm you know, I'm apprehensive about the future. I I don't know when gonna get to grief and to take account of the losses. Uh, I don't know. I am. It reminds me growing up in the Caribbean, and every at least once a year there's a hurricane. You sort of sleep through it, wake up, go out, figure out what was destroyed, and start cleaning. And you move on. You just move through doing, cleaning your garden, cleaning neighbor's garden, finding out what happened, and then grieve with everybody else in your community. And I don't know how to do it differently yet.
And Carlos and Dana, I remember you saying in our planning call that you've had quite a lot of loss at your hospital. Yeah.
Unfortunately, as of today, we have lost 12 of our colleagues, and we have around 400 patients that have passed.
Yeah, so it's one of those things that certainly is running through, it's certainly living in the walls right now of the hospital. And I think partly what we hope to do is to continue to help people move that as opposed to allowing it to get stuck. And by bridging, we're talking about our personal lives versus our professional lives, by creating spaces like a morning room where staff can begin to process this personal experience in what is a space in the hospital that feels separate from the hospital, to be able to continue to have the action, the performance of mourning, instead of trying to stifle it down. Because I think that's something that we often get really good at in healthcare, is just setting aside our own personal needs. And I think we need to begin to integrate the two of them and think a little bit more about queering these hospital spaces so that they can support all of the perspectives.
So on that note, I would love for Deborah, for us to close out. Before we close out, I want to say thank you to all of you for sharing so much of your hearts with us. We're so grateful. We clap for you, but really being able to dialogue with you is such an honor. And if there are any follow-up questions, you can feel free to email Rattlestick and we'll forward them along to the panelists, so don't worry. But I would love for us to end with a poem that Deborah wrote, and then we will say goodbye. So thank you very much for your time and your energy with us. And now to Deborah.
Okay, so this is a poem that I wrote when my hospital had just opened a corona screening clinic mid-March, and people were just coming in. We were just starting to screen them, and it was all very shocking. We just didn't know what would happen. And so I wrote about my reflections, and I called it I Can't Breathe. The mask is tight, but I am glad I have one. The face of fear looks in my eyes. I can't breathe. The scary virus, like a monster, has stormed into this world we love. Please tilt your head back and I'll be gentle. The swab goes in, the coughing starts. I turn my head and offer tissues, give instructions, and a silent prayer. Please recover well at home. Please recover. The thought of worse makes my throat constrict and I can't breathe. Then in the long hallways of the hospital, once full of energy and casual banter, now in eerie silence, masks on everyone hide the expressions which no longer smile. I think of all that has been lost and all the loss yet to come, and I can't breathe. A change of clothes and into my house. What am I bringing in the door with me to those I cherish most? I took an oath, but they did not. And the thought of hurting the ones I lived most for. When will the monster leave us, leave every corner of our lives? When can we return to full embraces? So we reconnect from 6 feet apart. Some usual chatter, so normal, such comfort. I look outside, the trees with flowers, the bright blue sky still manages to sparkle. A hug for my daughter, she will accept nothing less, and a guilty feeling. Is my love hurting her? Is her unconditional love hurting herself? Is a week of flu, we hope, worse than a distant mother? And can you really parent from 6 feet away? Will we ever be okay? So I hold my breath and then I pray for those who may never breathe again.